So we started the clinic in response to patients that were having ongoing symptoms related to COVID-19. There's a number of patients that are having symptoms that are continuing after their COVID-19 infection, lasting for months. The symptoms can include anything from fatigue to cognitive dysfunction or brain fog, as patients say. They can include muscle aches, joint aches, extreme exhaustion after doing any kind of activity. And we found that we needed to start this clinic now because there is research being done in regards to finding out why this is happening and how we can treat it, but we felt that there were enough of these patients around that we needed to start to find ways to help them now. So in building the clinic, we've been consulting with specialists, working kind of through myself as a conduit to start seeing these patients and start helping them. One thing that I like to highlight is a phenomenon that we see called Post-Exertional Malaise. That is to mean that if a patient was to do too much physical or mental activity, they get a flare in all of their symptoms. So that's something that's really common that we don't see in many other types of diseases that we normally treat. So in terms of treatments, the main treatments that we've been working with patients, the main thing that we've seen has helped is that education around some of those symptoms. I think there's a lot of different things happening to patients' bodies and in terms of what they're experiencing. And giving them that knowledge in terms of how to manage these symptoms is a big help in terms of trying to get them better and manage their day-to-day lives. It's also very important for us to take an individualized approach to treating these patients. I think every patient that we've seen has a different presentation. There's similar patterns, but there's not a one size fits all for these patients. We need to take an individualized approach and consider all of the biological, but also all the social things that are related to this disease, because it's a multi-system disease that affects these patients' entire well-being. So we work together with specialists. We work together with our mental health team, our physiotherapy exercise team, and it really takes the whole team to help treat these patients. I think for the healthcare professionals, number one, certainly validate your patient's symptoms. I've in my short experience with working with these patients, a lot of them are already starting to feel stigmatized in terms of their symptoms. They're either being denied or delayed treatment because they've had COVID, or denied being seen in person even though they're not contagious anymore. So definitely do your best to educate yourselves in regards to these conditions, because these people need care. The second thing is, as I mentioned before, this phenomenon of post-exertional malaise is something that we're not used to treating. In many other conditions, depression, anxiety, chronic pain, we recommend exercise. We push people to get back to work and to get active more quickly. But with this particular population, if we push them too hard, it'll flare their symptoms and make them worse. So in our return to work plans, or the management plans, has to be considerate of those things, because they can make patient symptoms worse. So absolutely, we need to work as a team to figure these things out. For other healthcare professionals, if there's questions about what we're doing or how we can help you, we're certainly open to meeting and contacting people about that. This is something that we're all learning and sort of building the ship as we're flying it, so to speak. So things are changing, and we need to work together to figure these things out for patients. For patients yourselves, a similar kind of approach. Definitely be cautious about pushing yourself too far, because as if you're experiencing symptoms, you probably already are experiencing this to a degree, this roller coastering of symptoms that can, you feel good, you do a lot, and then you pay for it the next 2 days. And that's not how we get you better with this disease. We need to take a much more cautious and a much more slow and paced approach to your symptoms. So if you're struggling, certainly start reaching out towards your family doctors. You can reach out towards us, and we'll see if we can get you connected and see if we can get you feeling better.